Explosion injuries. Definitions. Bomb. Bomb is a container filled with an explosive mixture and missile which is fired either by detonator or a fuse. Incendiary bombs. Napalm bombs primarily cause burns. Usually phosphorus and magnesium are added. Temperature 1000 degrees produced. Oh. Molotov cocktail is an incendiary bomb which is thrown by hand. In its crude form, a bottle is filled with gasoline and a rag to serve as a wick. The wick is lighted and thrown at the target. Next is blast injury. It's a complex type of physical trauma resulting from direct or indirect exposure to an explosion causes sudden increase or decrease in atmospheric pressure. If the force of the explosion is transmitted through the air, the term air blast is used. If through water, immersion blast. If through solid, it is called as a solid blast. An air blast produces compression of the body towards the side of the explosion. The injuries are less severe compared to immersion blast as force is dissipated in all directions and the molecules of the mediums are less densely packed. In an immersion blast, the body is compressed from all directions as the molecules of the media are closely situated and damaged will be diffused. The liquid is in a closed space. A shock wave from the air outside the liquid surface amplifies the shock waves in the media and the injury will be severe. In case of solid blast, the force is transmitted through the part of the body in contact with the vibrating solid structures. Effect of primary and secondary impact and secondary injuries may be primary, secondary impact and secondary injuries may be seen on the body. Mechanism of action. The explosive pressure that accompanies the bursting of bombs or shell rupture their casing and imparts a high velocity to the resulting fragment. These fragments have the potential to cause more devastating injuries to the tissues than a bullet. In addition, all explosives are accompanied by a complex wave. The two main components of these waves are a blast wave that are known as a dynamic overpressure with a positive and negative phase. The blast wind, mass movement of air. Injuries are mainly due to initial shock wave but are aggravated by the subatmospheric phase. The positive pressure phase of the blast wave lasts a few milliseconds, but close to an explosion it may rise to over 7000 kN per meter square. As a tympanic membrane rupture at about 150 kN per meter square, effect on the human body of such explosions can be devastating. Like a sound wave, the blast pressure waves flow around an obstruction and affect anyone sheltering behind a wall or a trench. Also, any person standing in front of a wall or any surface facing an explosion is subjected to the added effect of a reflected pressure. The mass movement of air, the blast wind disrupt the environment, throwing debris and people. This phenomenon result in injuries ranging from traumatic amputation to disruption. When the body is impacted by a blast pressure wave, it couples into the body and set up a series of stress waves which are capable of injury and particularly at air fluid interface. Thus, injury to the ear, lungs, heart, and the gastrointestine is notable. High pressure area, atmospheric, subatmospheric pressure area, shock waves, peak pressure. Classification of explosive based on the material used: high order explosive, low order explosive. High order explosive undergo detonation, producing an instantaneous blast wave under extremely high pressure, causing severe primary blastic injury. Example: TNT, dynamite, ammonium nitrate, C4 plastic explosive. Low order explosive undergo deflagration rather than detonation, thus lacking in blaze wave. Uncommonly to cause a pulmonary and central nervous system injuries unique to primary blast injury. They are composed of propellant such as black powder, pyrotechnic such as firework and oil, or a petroleum-based explosives such as Molotov cocktail. Classifications of the injuries. Blast injuries are divided into four categories: primary, secondary, tertiary, and coronary. The primary injuries are characterized by the absence of external injuries. They are usually internal injuries which are often unrecognized and their severity underestimated. The ears are the most often affected by the overpressure, followed by the lungs and the hollow organs of the GIT. GIT injuries are present after a delay of hours or even days. Primary blast injuries are acoustic barotrauma. Commonly consist of a rupture of the tympanic membrane, dislocation of the ossicles, and widespread disruption of the inner ear, leading to permanent deafness. Lungs, considerable disruption at the alveolar capillary membrane, air fluid interface lead to capillary leakage, resulting in extensive hemorrhage in both lobes of the lung. There is pulmonary contusion, systemic air embolism, and free radical associated injuries such as thrombosis and disseminated intravascular coagulation, or combination of all this. That is blast lung. Okay, what is blast lung? Considerable disruption at the alveolar capillary membrane, air fluid interface leads to capillary leakage, resulting in extensive hemorrhage in both lobes of the lung. There is pulmonary contusion is there, systemic air embolism, and free radical associated injuries such as thrombosis and disseminated intravascular coagulation, of combination of all this known as a blast injury. ARDS may be a result from direct lung injury or of a shock from other body injuries. Blast lung is the most common cause of death among people who initially survive an explosion. Clinically characterized by a triad of dyspnea, bradycardia, hypotension, and the patient present with a dyspnea, cough, hemoptysis. Just radiographic in the initial stage may show localized contusion injury, but as the time passes, the effect becomes generalized with a bilateral fluffy infiltrate spreading out from the hilum of both lungs, a butterfly pattern. GIT, injury to the gas-filled viscera, is more common in underwater exposure than in air blast. Although the colon is mostly commonly affected, perforation of the stomach, small intestine, and cecum are also seen. Brain, it can cause a concussion or a mild traumatic brain injury without a direct blow to the head. There may be headache, fatigue, poor concentration, lethargy, depression, anxiety, insomnia, or other constitutional symptoms. Secondary injuries. The most casualties are caused by secondary injuries. Some explosives, such as nail bombs, are purposely designed to increase the likelihood of the secondary injuries. Penetrating thoracic trauma, including laceration of the heart, great vessels, is a common cause of death. Tertiary injury may present as a combination of blunt and penetrating trauma, including bone fracture and counter-coup injuries. Children are at a particular risk of their lesser weight. Coronary injuries, miscellaneous injuries, psychiatric injuries due to neurological damage sustained during the blast is a common, and post-traumatic stress disorder (PTSD) may affect people who are otherwise completely uninjured. Sequelae of traumatic injuries. Crush syndrome and acute renal failure may occur in patients rescued from collapsed structures. Increasing extremity pain or after an explosion may indicate developing compartment syndrome. Workup. So this is primary, secondary injury, tertiary injury. In the primary injury, there is you need to HE result from blast wave, high explosive unique to high explosives result from blast wave, over pressurization wave, body part affected gas filled structures, lung, GIT, and middle ear. Tympanic membrane rupture and middle ear damage, blastic lung, abdominal perforation and hemorrhage, concussion, globi rupture. Secondary result from flying debris and shrapnels and bomb fragment. Any body part may be affected. Penetrating or blunt injuries, high penetration can be occurred. Tertiary result from individuals being thrown by the blast wind against the solid object. Any part may be affected. Fracture and traumatic amputation, closed and open brain injury. Coronary injuries not included in the first three categories include exacerbation or complication of existing condition. Any body part may be affected. Burns, flash, partial or full thickness, crush injury, closed and open brain injury, asthma, COPD, and other breathing problems such as from dust, smoke, or toxic fumes, angina, and hyperglycemia, hypertension. When the bomb explodes, the temperature of the explosive gases can exceed 2000 degrees Celsius, and the heat radiated momentarily can cause flash burns. Workup. The most common urgent clinical problem in survivors is usually the penetrating injury caused by blast, energized debris and fragments from crossing of the exploding device. Many of those exposed will have blunt blast and thermal injuries in addition to more obvious penetrating wounds are referred to as a combined injury. The soft tissue wounds are heavily contaminated with the dirt, clothing, and secondary missiles such as wood, masonry, and other material from the environment. Flying missile. Medical legal aspect. Forensic pathologists may encounter blast injuries in both routine casework and as a part of mass casualty events. Therefore, recognition, proper interpretation, and documentation of this type of injuries would assist with the reconstruction of the incident. Whether a bomb explosion has caused the injuries, full body photograph and complete x-rays of the whole body are indicated before the clothes are removed. Any opaque fragments and radiolucent material, paper fragment, wood and plastic may be components of an explosive device. 3D, CT, bony reconstruction, and even soft tissue injuries from projectiles with the foreign body in them may help reconstruct the explosion. Residues are either burned black or grey, unburned yellow, brown, or grey materials. Swab the soiled skin and hands, collect hair and fingernail scrapings. Foreign body sharpeners or empty shell may be found during autopsy. Toxicological analysis may also help. Extensive burns are usually not caused by direct localized bomb explosion. Number of a dead person and major initial problem correct. Fragments are to be allocated to the right individual. Identification of the dead injuries can be extreme and thus make identification and interpretation difficult for the autopsy surgeon. All body parts and clothings are recovered. Clothing is submitted in airtight containers. Dentition, dentures, and artificial teeth also help in identification. Fingerprinting may also help. Hand injury in case of hand-held explosive. Martial triad of bruising, abrasion, laceration with soot, soiling, and tattooing. In distinct the injuries, external and internal injuries are described in detail. External injuries. Total body disintegration indicates high order condensed explosive at a close range. There may be mangling of body near explosion with the parts of extremities amputated. Craniofacial injuries are seen in case of suicide. Lower limb amputation is a typical of standing or seated individual. Hand injuries are seen if explosive was held. There may be projectile injury. Punctuate laceration, dusty tattooing, and black soiling from explosive material may be seen. Martial triad of bruises, abrasion, and punctuate laceration with the tattooing of the body indicates bomb explosion. Injuries are seen due to fallen rubble, burns, flash burns, and singed hair seen on victims in immediate vicinity. Internal injuries have been described earlier. Cause of death may result from variety of causes. Complete disintegration of the body, blast, shock, burns, blunt force injuries, and crush asphyxia. Circumstances of death need to be looked for. Recognize the suicide bomber. Difficult nature of suicide bomber injuries is vital in locating and identifying this type of offenders. Hands are examined to determine whether he was holding the explosive or not. Thank you.